And as COVID cases continue to rise, so is the chance for you to come into contact with somebody who has it. News 4's Alexandria Adams spoke to an infectious disease specialist about the steps we all should take.
In general, it takes somewhere between 2 to 3 days and 2 weeks before symptoms begin.
Dr. David Aronoff, the director of the Division of Infectious Disease at Vanderbilt University Medical Center, says if you find out you've been exposed to someone who has tested positive for COVID-19, you should isolate yourself as much as you can.
If you've had a significant exposure, a close exposure within 6 feet for more than 10 to 15 minutes with somebody who tested positive for COVID-19, you should lay low at home and monitor for symptoms.
And if you just have to get out,
they should try to distance themselves from others. Ideally, that would be self-isolating, perhaps at home. If they need to be out and about for any reason, they should continue to respect distance between themselves and others and wear a mask.
Those who have been exposed to a person who has tested positive for the virus should inform their employer immediately.
It is prudent to contact their employer, your own employer, and say, I think I've been exposed to COVID-19. See if you can make arrangements to stay home.
The doctor says it's sometimes challenging for those who aren't showing symptoms to be tested. He recommends if you do start to show symptoms, get tested.
By 2 weeks, if somebody has not gotten symptoms, they are either not infected or they are in the minority of people who get infected but never develop symptoms. Because this virus is going from people without symptoms to other people. And a fraction of people are developing symptoms, and an even smaller fraction of those folks are getting sick enough to go to the hospital or dying. But there are many transmission events going on that are underneath the radar.
Reporting for News 4 Nashville, I'm Alexandria Adams.